Hey everybody, I'm Steve Daisy with PTbyPTs.com. I'm a personal trainer, physical therapist, and strength and conditioning coach, not necessarily in that order. And today I want to talk to you about how to stop shoulder pain from killing your workout and how you can still design an incredibly effective workout routine without beating the ever-loving bleep out of your shoulders. So I've been treating orthopedic patients for about 25 years, which makes me old, and it means that I've seen a lot. Okay, probably the number one injury that I've seen that most forces people to stop working out is shoulder pain. Shoulder pain kills everything you do in the gym. I mean, not everything. It doesn't. I mean, you can still do your legs, but you can't just do your legs all the time, or you're gonna look ridiculous after a while. And it doesn't matter if you're diagnosed with a tendonitis, bursitis, impingement syndrome, labral instability, or even a full thickness rotator cuff tear. There are a number of very safe and effective exercises you can still do. Not only will they help your shoulder, they'll actually build muscle as well, assuming you train hard. Now, I'm not talking about the little Mickey Mouse physical therapy exercises with the TheraBand and the 2-pound weights and the TheraTube and the rubbing your balls on the wall. Did I just say that? I did. Let me rephrase that. I will not ask you to ever rub balls on the wall. If done correctly, what I will actually show you will actually make up an actual workout routine that's actually effective at building actual muscle strength and mass. And almost anyone with almost any kind of shoulder problems can do this. You can do what I'm about to show you. You can do it as one workout. You can mix it in with a circuit, or you can divide it up. You can do whatever the heck it is you want to do with it, because that's what freedom is. So let's get started.
First up is the seated row. I like the seated row over other exercises because the lower back is stabilized by the pad in front of you. It's very easy on the shoulders and it targets muscles that are critical to normal shoulder function, mainly the scapular adductors. This means the rhomboid muscles, the middle trapezius muscles, and the lower trapezius muscles, all of which help maintain good posture so that your rotator cuff can work optimally. Studies show that the row in general works this area very, very well. The most important aspect of form with rows is beginning the movement by pulling with your shoulder blades. You'll want to pinch them down and together. If you slowly stick your chest out at the same time as you're pinching your shoulder blades together, it'll help facilitate movement from the shoulder blades. Return in exactly the same manner. Try to focus on using the muscles between your shoulder blades to make the row work. This exercise puts minimal stress on the shoulders, and you should be able to tolerate enough weight to tire even in the 6 repetition range. And of course, it can be performed with one arm as well. Next is the seated bench press. Bench presses and flies in general can really irritate the shoulders, especially for people with shoulder impingement and instability problems. The seated bench press allows you to start at a safe angle using the foot pedals to adjust the starting position. Your hands can usually also be placed in such a way that your arms are closer to your sides. This takes even more stress off the shoulders. At the same time, you can absolutely crank up the weight on this machine safely without a spotter. Remember to keep your posture upright and sit fully back in the seat. Keep the exercise within a range of motion that keeps you from feeling anything at all in your shoulders. Your pectoral muscles should be what burns out and gets tired. The two-hand shoulder extension takes you through the motion of a pullover very safely. While you do lose out on the overhead part of the lift, it's still effective mostly for the lats, but also a little for the pecs as well. With your arms in front of you, holding a bar attached to a cable machine, adjust your posture so that you're close to perfect alignment with your shoulders back and chest out. It helps to mildly draw in your lower abdomen as well. With your elbows straight, pull your arms straight down toward your waist. At the end of the movement, pinch your shoulder blades back together. You're going to feel this in a number of areas, but mostly in the lats, triceps, and even the abdominals if the weight is high enough. The trick to doing this correctly is maintaining really good posture. Because the shoulders never go above 90 degrees, this is tolerated by almost anyone with shoulder issues. The main problem with biceps curls in some people with shoulder issues is the fact that the long head of the biceps tendon inserts into the shoulder and blends in with the glenoid labrum. It's not uncommon for people to rupture this tendon eventually after long-term wear. So to that end, a hammer curl will shift a lot of the burden from the long head of the biceps to the brachialis and the brachioradialis muscles. With the arm at the side, there's basically no shoulder stress. If you can perform other types of curls such as concentration curls or two-handed dumbbell curls without shoulder pain, then these can be substituted as well. The cable triceps press is another guaranteed way of working your arms without any real stress to the shoulders. The cable triceps press works all three heads of the triceps just as well as any other triceps exercise. Be sure to keep your posture very upright, your shoulders and shoulder blades back, and your arms tucked in. This exercise can also be performed using one arm at a time as well. The reverse pec deck exercise also hits the posterior or rear deltoid as well as the rhomboids, middle trapezius, and infraspinatus muscles, the back part of the rotator cuff. These muscles in general don't get worked nearly enough. All the muscles worked during the reverse pec deck exercise help the shoulder function better by improving your upright posture, so make sure you sit really upright while sticking your chest forward. Try to focus on pulling just with the posterior deltoid since you already did a seated row where everything else got worked. You can also do this exercise safely using a cable pulley system as shown here. It does become a little more difficult though to isolate the posterior deltoid as the muscles around the shoulder blade are bound to help out a bit. So we're back to a shoulder extension exercise, but this time we're going to change the focus a bit. Doing it with one hand, you're going to concentrate mainly on using the posterior deltoid and the muscles around the shoulder blade to complete the lift. This can be performed standing with a cable or kneeling over a bench as you see here. Studies show the single arm shoulder extension uses the subscapularis or front part of the rotator cuff much more than the supraspinatus or the upper part of the rotator cuff. This is important because it's the supraspinatus that is much more likely to be irritated and torn. This way, not only won't you stress the supraspinatus, but you'll help in building up the rest of the rotator cuff to compensate for it if you already have problems there. Your posture and motion are going to be exactly the same as they were with the two-handed shoulder extension, only this time, of course, you're just using one arm. Last are the two exercises that directly work the rotator cuff. These exercises attempt to isolate the rotator cuff, so they should always be done last. The shoulder internal rotation exercise mainly works the subscapularis muscle. This is the front part of the rotator cuff and is critical for helping with things like anterior shoulder instability. It's also part of the rotator cuff that is going to take over when the supraspinatus muscle is torn, which it is more than 80% of the time in cases of rotator cuff tears. Internal rotation is performed with the arm at your side using a cable, while keeping your elbow locked at 90 degrees. It's really important in this case to keep your posture upright, as this will decrease stress on the pecs, allowing you to more closely isolate the subscapularis. External rotation works in just the opposite direction. In this case, the posterior muscles of the rotator cuff are worked, mainly the infraspinatus and teres minor, but the supraspinatus works a good deal as well. For that reason, this exercise is sometimes not tolerated well in people with shoulder problems, so really make sure you feel fatigue and burning in the area of the infraspinatus or posterior deltoid, that is, in the back of the shoulder. If you feel anything inside the shoulder or pain in the front, stop doing this exercise. While you can use pretty heavy weight with all the previous exercises, the shoulder internal and external rotation exercises should be done with weight that fatigues you more in the 10 to 20 rep range. Let's go over a few safety reminders. First, it's important to do the exercises in the order shown. Remember that your deltoid and rotator cuff muscles are always working in the background during other multi-joint exercises, so work the big muscles first and the shoulders last. Second, remember that the feeling of burning and fatigue should only be in the muscles themselves and not in your shoulder joint. And third, if you have any pain or clicking in the shoulders, stop immediately and consult a physician or physical therapist.
So we're just scratching the surface here on how to stop shoulder pain from killing your workout. You can really expand on this a great deal with parascapular type exercises like stuff for the serratus, the middle and lower trapezius. So if you want to learn more, please check out my website at ptbypts.com, personal training by physical therapists, where we actually have our 12-week shoulder solutions program, as well as one-on-one personal training where we actually expand on all of this. So thanks so much for watching. If you enjoyed this video, please hit the like button, subscribe, do me that big favor, comment, visit the website. And until next time, I'm Steve Daisy with ptbypts.com, personal training by physical therapists.